have a group of specialists and subspecialists at the Hospital of Central Connecticut that is as skilled as any you'll find in any hospital across the country. We're able to provide a wide variety of advanced surgical therapies for patients in urology. If you need it, we can provide it. At the Hospital of Central Connecticut, we can perform robotic partial nephrectomies, and that's a surgery for removal of kidney cancer where the healthy kidney is preserved while the part of the kidney that has the tumor is removed. Historically, this was performed through a fairly large incision, which was painful for patients, but if one is able to perform it with a robot, which is what I do, you can perform it through very small incisions, and patients therefore can breathe easier after surgery and recover faster.
We essentially use the robot to take out just the cancerous tissue and then leave healthy remaining tissue behind. To me, it's amazing that we can go in, take out a piece of someone's kidney, and then see them the next day and they're essentially up walking around, and then after as little as a day or two, they're going home feeling back to their usual selves within a week.
At the Hospital of Central Connecticut, we have patients who need to have their bladders removed because of bladder cancer. And in order to provide them the most functionally normal recovery afterwards, one can create what's called a neobladder. And that's where I create a new bladder for the patient out of their small intestine. We have been performing these laparoscopically with the aid of the robot, giving patients a faster recovery and less chance of complications. Our robotic surgery team is excellent and includes our anesthesiologist, our nurse anesthetist, scrub tech, OR nurse, and then my physician assistant, Chris.
What's great about at the Hospital of Central Connecticut is that we have a dedicated robotics team, and really the benefit of having all these people work in this, the team setting is just having the familiarity with each other. We can really work as a more efficient team, which makes things much better for the patient.
The teamwork is excellent and it's essential to accomplishing these cases, and so we all know each other's moves very well and things go very smoothly.
Dr. Dorin and I have a very close relationship. If I have a question about a patient, he's more than happy to offer assistance. Our relationship definitely translates to a more effective relationship in the OR. At this point, I've been working with him for 3.5 years, and I know what he wants before he can even ask. What first got me interested in the job was actually as a student. I had the opportunity to work with Dr. Dorin when he was a fellow, and I got to see a robotic prostatectomy, and being in a robotic surgery was something that kind of clicked with me, and I really enjoyed it and I wanted to do more of it. I got lucky enough to have the chance to get a job with Dr. Dorin after I graduated from school, and it's been a job that I've loved every day since.
I'm proudest of the care we're able to give to our cancer patients who often feel as though they don't have any good options or they'd have to travel very far to get the best possible care. And then to see patients who have gone years and years now cancer-free and have become part of our family in this community.
The look of relief on their face is what kind of is the most satisfying to me.
The Hospital of Central Connecticut is a special place. Although it's not the biggest hospital in the state, we're able to accomplish amazing, complex surgeries right in your backyard with some of the best specialists you're going to find anywhere.